Good morning, everyone. Today, in this lecture, we are going to discuss about, or you can say it's a continuation of the previous lecture, in which we are going to discuss about the poisonings, other common poisonings, and basically what I'm going doing is like I'm just giving you examples. Of course, it's not like this. We can discuss all the type of poisons and what are the diagnostics. Of course, I have to give you concept, and when you will study different poisonings, then you would know what kind of investigations are done because every poison have different effects. Some of the poisons they affect the liver, some of the poisons or drugs they affect the kidneys, some causes some acid base abnormalities, some are cardiotoxic, some are neurotoxic, so and the list goes on, of course. So that's why it's very hard for anyone to talk about all the poisonings, okay, in diagnostics. So it's just for concepts basis. Now, um, I would start with salicylates. And to many who don't know what is salicylates, again, salicylates is also present in most of the homes, very easily accessible drugs. And the common name which people use for this drug is aspirin. Okay, so it is basically aspirin. So, again, it is present almost in every home, and it also comes in many preparations, many packings, and one of the common cause of common overdose, you can say, which can be seen. Okay, like in paracetamol, we check the liver function testings, we check the ABGs, and we check the paracetamol levels just to follow the normogram. In this one, what things we uh, um get is on the labs, we check the salicylate levels, number one. And the other, which is very important thing, we check for the abnormalities of acid base balance. Of course, like for that, we go for ABGs most of the time. ABGs are what, like atrial blood gases. So, and now to tell you uh, a little about aspirin poisoning or salicylate poisoning. What happened when anyone uh, take aspirin in higher dosages? So, what is the function of salicylates or aspirin? Of course, uh, it is used mostly. Okay, it is called as blood thinning medications in layman term, right? So, what happens is when someone takes in too much dose, so they have like some general symptoms which are present in almost every type of poisoning, like nausea, vomiting, abdominal pain, tinnitus is common in this one. But what happens then? They present with high body temperature or hyperthermia with tachypnea, and due to tachypnea, they can go into respiratory alkalosis. If you had a concept about acid base balance, tachypnea is going to blow out carbon dioxide. Carbon dioxide is a acidic gas. So the blood pH goes to the basic side, and later on, it can cause metabolic acidosis. So, see, first of all, it is by its direct action on the respiratory center, it is going to cause respiratory alkalosis, and later on, it is causing metabolic acidosis. So, if you will see or pay attention, two things are occurring. One is alkalosis, and one is acidosis. Okay, and of course, there are many other features. The patients can even go to coma, but of course, like that's not our discussion. And you can say, um, if you will go in detailed pathophysiology of salicylate poisoning, you would know like we divide the thing into three phases. For example, phase one is when hyperventilation is going on. Why? Because the aspirin directly activates the respiratory center, and it will lead to respiratory alkalosis. And then the person, it enters into the second phase, in which what will happen, that they will go into what you can say, uh, that the body will try to compensate the respiratory alkalosis. It is going to produce more and more acidic, what you can say, acid in the body. And basically, due to this, the kidney, they lost a lot of potassium. And then the person, it enters into the phase 3, in which like there could be hypokalemia, because the body lose a lot of potassium, and the body will go enter into the metabolic acidosis phase. Now, um, as I was talking about the diagnostics, like as we are here and discussing the diagnostics of this condition, so we must know what are the lab tests we do, right? And of course, like we are not going to discuss about the treatment, okay? And that's what I told you, like I talk about in detail about paracetamol, just to give you the concept. So first of the thing we check is the salicylate level, because why? When the levels are high, the organ damage is more. Okay. Uh, Now, the absorption of salicylate is usually slow. So that's why whenever anyone comes with poisoning, we do repeated tests to check for the salicylate levels. Okay. And when we do this thing, when we check the levels, the toxic dose of aspirin is considered when anyone have consumed more than 150 milligram per kilogram. Okay, so that is the toxic dose, and anyone who have consumed um, up to 300 milligram per kilogram is considered as moderate toxicity. And but above, you can say 300 milligram per kilogram, you can say uh, above uh, above 300 milligram per is kilogram is uh, severe toxicity. Okay, it's a severe toxicity. So what you can say, so severe toxicity is basically, like anyone who have more than 300 milligram per kilogram. So, and of course, like anyone who have consumed more than 500, that is a short lethal dose. Lethal means, it can kill the patient very, very, very quickly, you can say. So, uh, of course, like for diagnosis, we can do the salicylate level in the blood. So, you can say the plasma salicylate levels generally range from 300 to 100 milligram per liter, or you can say 3 to 10 milligram per deciliter, after like in the patients who are taking aspirin usually. So when the levels are 50 or more than that, or you can say 50 to 300, it means like the patient have taken a higher dosages, but any level above that clearly shows that it's an acute lethal dose, or a toxic dose is taken by the patient. So of course, like that needs some urgent treatment or attention. So we go for salicylate levels. Other thing which is called it is causing the acid base imbalance, right? So uh, as I told you, first of all, the patients go into respiratory alkalosis, and later on they will go into phase 3. They will go into their metabolic acidosis. So uh, now, why there is respiratory alkalosis? Because of direct action on the, or you can say direct activation, better, uh, of respiratory center. And again, I don't know how, like, you guys know or not, but like, where is respiratory center? It is the brainstem. And the patients, they go into hyperventilation, they blow off more and more carbon dioxide, and they will go into respiratory alkalosis. And uh, what happens, like, later on they will develop metabolic acidosis, right? So this is simply like due to production of the acids. Okay, so now maybe the overall effect in the patient is a normal pH. Okay, so or maybe the acidosis will be more than alkalosis, or maybe the alkalosis is more than acidosis. So it is very hard to interpret in this case, of course, because okay, we call this thing as mixed type of acid base abnormality. Okay, or both alkalosis and acidosis are going on, so we say that it is mixed type of metabolic abnormality or pH abnormality. So what are the tests now? See, what are the labs you can do? Okay, diagnostics for salicylate poisoning. So see, first of all, we can check the salicylate levels. Okay, makes sense, because we want to see like are the doses lethal or not, right? So of course, salicylate levels are going to tell you this thing. Second thing, what we can do is we can go for arterial blood gases, which I told you, in like whenever we go for arterial blood gases, it gives you the carbon dioxide level, the bicarbonate levels, the pH, okay, in the patient. So you will ask the patient for um, atrial blood gases. Now, we can also go for complete blood examination or complete cell count. You can also go for LFTs, or the liver function test, and RFTs, or the renal function test. Okay. So in reality, of course, they do a lot of tests because they want to check everything. Okay, and salicylate also give a high anion gap metabolic alkalosis acidosis, or increase in ion gap metabolic acidosis it gives. So see, we are doing all this tests just to see what's going on with the patient. Okay, so of course, like this one will be diagnostic, right? But these one we are doing to check the condition of the patient. And of course, one very important thing I forget, electrolytes. Hypokalemia is there, right? So for that, you can do the blood electrolytes or serum electrolytes, just to see like what is the electrolyte level, either there is having hypokalemia or whatever like is the condition of the blood or the electrolyte. So that's again makes a very, very, very important type of investigation. And not just these, of course, we will go for much investigations, but again, like these are the things which everyone will do or must do if anyone is presenting or suspect of um, salicylate poisoning. And then, of course, we go for treatment, but treatment is not our discussion. Now, I will give you a very small, what you can say, explanation of one more poisoning. That is opiates poisoning. Now, opiate poisoning, um, and why include this thing? There's a special reason, and why I'm talking it about aspirin, for example. Uh, First of all, for many, what is opiates or what is opioids. Basically, this is again a very common type of poisoning. Why? There are certain reasons. If you ever heard a thing called as heroin, there are people who abuse heroin. So heroin is a opiate, but that's not the only way of poisoning, because if like in medicine, when the patients they have pain, we put them on morphine. So morphine is a poisoning itself. Like morphine can cause poisoning itself. Methadone, tramadol, there are many drugs which are opiates. Okay. Now, the good thing, we have a antidote, and the antidote is naloxone. But what opiate poisoning do? Opiates suppress the respiratory system, the respiratory center, sorry. Salicylates activate, opiates depress. Okay. So what will happen in these patients? Their respiration will be slow. They will hypoventilate. So when they are hypoventilating, what will happen? Again, exactly opposite to what happens in salicylate poisoning. Now, basically, anyone who is taking opiates in overdose, no matter he's a drug abuser or he's using the drug for any treatment or accidentally, whatever. So how they will present? They will be having slow breathing. Okay, their breathing rate will be very slow. Okay, of course, like this is not the only symptoms, guys. There are a lot of other things. Okay, which happen, like it is not the only finding, but they will be having pinpoint pupil. They have, you can say, meiosis. Okay, and they have altered no, decreased, because of course, like they have decreased level of consciousness. Now we had one lecture on physical diagnostics in which we discuss about the uh, problem with the consciousness level, right? Okay, and there are many other things which can occur, right? Seizures can occur or things like this. So now there is respiratory depression, slow breathing. So what will happen? Due to this respiratory depression, due to this slow breathing, they will be having less oxygen in the body. Okay. Now, uh, when there is less oxygen in the body, it can cause multiple problems, right? It can cause a lot of problems, guys. So now, um, why we are going to discuss this, or why I'm discussing this thing here in, you can say, um, diagnostics, is because in this one the diagnostics is completely different, because the lab tests which can be done are very different. For example, most of the time this opiate poisoning is a clinical diagnosis. Okay, so for diagnosis, when we found this or this with a history of opiate poisoning, like abuse or misuse, we make the diagnosis. Okay, so now see, the labs are not important in this one, but still we go for multiple tests. Why? Because this one simulate, or you can say, looks like certain other conditions. Like anyone who have had head trauma, they can present with the same symptoms. Anyone who have alcohol intoxication, they can present with the same symptoms. Anyone who had stroke, they can present with same symptoms. Anyone who have hypoglycemia. So they presented the same symptoms. So you can say that diagnosis, just to make you clear, the diagnosis is clinical. This thing is understood, right? The diagnostic mostly is clinical, but lab tests can be done to rule out differentials. So see, we will do blood plasma glucose just to check either it's hypoglycemia. We will do CT scan just to check if there is any head trauma or stroke. We will do alcohol levels, okay, just to see either the patient is intoxicated with alcohol. So see, it's a different story. That's why, like I am, I mention, you can say this thing over here, right? To tell you, to give you different aspects of diagnostics, right? How we can use and things like this simply. Uh, One of the drug which I wanted to talk about is TCA, or tricyclic anti or antidepressants, right? Now, tricyclic antidepressants, as you can see, they are antidepressants. So we give in the patients who have depression. Now, one important thing to understand here, guys, depressed people are already depressed. So when they are depressed, many of them, they want to commit suicide. And when they want to commit suicide, like the medications they have are the best source for suicide. So they can simply take that overdose in. So uh, there are different tricyclic antidepressants you will study in pharmacology, like amitriptyline. Okay, so now tricyclic antidepressants are extremely or extremely dangerous when taken in overdose. Okay, why? Because now they cause a very, very different kind of thing. For example, they cause cardiac toxicity. Number one. So cardiac toxicity, what kind of cardiac toxicity they can cause? Arrhythmias, even cardiac arrest. And the second thing, they can cause seizures. Okay. So now, again, see, anyone who have taken, for example, amitriptyline, take the example of amitriptyline, overdose, how they present, they present with, again, hyperthermia, blurred vision. Now, in this case, they may present with dilated pupil, they can present with seizures, they can present with tachycardia, they can even present with cardiac arrest or death, you can say, can occur. So, and symptoms always, or you can say mostly, okay, appear in the first 6 hours. Okay. Now, see, as I told you, that now see the effect, like you can say this is a neurological manifestation, this is the cardiac manifestation, right? So, what I wanted to tell you in this one is simply, um, if your basics are very strong, what happens is that TCAs are having anticholinergic effects, as well as they block norepinephrine, and also like they block adrenergic receptors, and they block the sodium membrane channel. So when they block the sodium membrane channel, what happens, like there is slowdown of the membrane depolarization, which will having arrhythmias. Okay, so these are all the things they are going to occur. Okay, now see the diagnostic test in this case, which we can do is, um, okay, labs for TCAs, poisoning, right? Okay, what are the labs you will do now? So now the labs will completely change. First of all, ECG. Now, why we go for ECG? Look here. If you know what is the normal ECG, or in the coming days we are going to study anyways, ECG or EKG, whatever you like, Americans they call it as EKG. So there are many things you written over here. First of all is tachycardia, you can see. The heart rate is increased. Okay. Other than that, what is this? The QRS complex is broadened. Normally, if you know, it is less than 0.12 seconds, or you can say less than 120 milliseconds. But in this case, it is wider than that. Okay. So, one thing is this thing. One thing is this thing. Second thing is this thing. The QRS complex are broadened. And remember, whenever the QRS complex are broadened, they are the risk of, the patient is at risk of cardiac arrhythmia as well as seizures. One of the things is they have AVR abnormalities or R wave abnormalities. What happens is like they have abnormally tall T wave, okay, in the lead AVR. So see this AVR lead, if you will see, this T wave is abnormally tall. Okay, this T wave is abnormally tall. Okay, also you know they have S wave in lead 1 and lead AVL. You can see this S wave or this S wave. These are the few changes you know we see on the ECG. And whenever these changes are present, it means like the patient is at risk of cardiac arrhythmias, the patient can be at risk of death. So see, what I wanted to tell you in this one, we are doing a completely different type of investigation. Okay. In this one, we are completely doing a different type of labs. Like we are doing ECG, we are going for ECG. Okay, of course, not just this. Of course, we can do other tests, but in TCA poisoning, this test becomes the most important test to do. Okay, so for example, one of the tests is what, like, okay, we can check the levels of TCA in the blood, but maybe this is not going to help you that much, but this one can save the patient, because if ECG have abnormalities, it means that the patient needs urgent care, urgent treatment. Understand? So now see, the dimension of the testing is changed. It is not the bloods, rather it's a ECG type of test. And of course, like one of the tests we can do is ABGs again. Now you'll be thinking like, you know, ABGs are coming again and again, but simply whenever there is any acid-base abnormality, they always go for ABGs. And what happens in this one, in TCA poisoning, guys, there is metabolic acidosis can occur. Okay. Even respiratory acidosis may also occur, but metabolic acidosis may occur. So see, the dimensions of the test of the test are completely changed. So see, why I included this thing is just because of this thing, that in one of the thing we go for the levels, and the treatment is based on the levels. In one of the thing we go for ABGs, we go for levels, we go for liver function tests, we go for multiple tests. In one of the thing, it's a clinical diagnosis, but why we are doing diagnostic tests, just to rule out the differentials. And in one of the things, see what type of testing we are doing. We are testing directly the organ which can be involved, that is heart in this case. So in this case, if we suspect anyone coming with TCA poisoning, we directly go for electrocardiogram, just to see either the patient is going towards cardiac toxicity or not. And if the patient is going towards cardiac toxicity, of course, our dimensions are changed, our treatment is changed, and we can do other testings as well. But this one is the most important one in this case. So I hope you understand this, guys. But as I told you, we cannot discuss each and every poisoning, because we are studying diagnostics. We are not studying toxicology. Okay. So of course, like we have to cover a range of topics, or we have to cover, and poisonings are too much, which you are going to study in forensics. And in forensics, you will be like, they are going to teach you many poisonings, not just drugs, but like some of the poisonings which can occur other than drugs, like lead poisoning, mercury poisoning, and things like this. Okay, so I hope you understand this lecture, and I hope you like this lecture. So, and I hope you get the concept which I wanted to teach you. So, thank you so much, guys, for listening, and I will see you around.